I have the pleasure now of moderating a panel that's, I think we entitled it COP29 and Beyond. It's a panel that was meant to explore the best strategies and approaches to advocating for health's inclusion in the climate agenda. And I think advocacy means a little bit different things to different people. I think what we can all agree is that issue advocacy is just the promotion of a cause that we all care very much about. I think that's been made clear over the last couple of days of programming, that we all care very much about the fact that human health is impacted by climate change, and that the climate agenda to date has somewhat neglected that fact and failed to integrate the health issue as well as it should in discussions, negotiations, and in the climate agenda. But of course, beyond promoting that issue is a whole set of more technical advocacy aspects that require us to really think harder about what it is we're hoping to accomplish, what are the intermediate steps to get there, and how do we do that? And so I think we have a great panel compiled to help us do that. We're going to start with some remarks from our Firestarter today, who is Dr. Jeni Miller. And you're probably all familiar with Dr. Miller. She is the Executive Director of the Global Climate and Health Alliance. That organization helps to coordinate efforts of national, regional, and international health organizations that are addressing climate change. And so if you haven't already, you're going to want to go check out the Global Climate and Health Alliance, sign up for their really helpful emails and updates. They also offer a whole host of really amazing webinars that I know a lot of the Forecasting Healthy Futures partners have benefited from. In fact, many of you maybe participated in one of their COP101 sessions over the last couple weeks, which for anyone who hasn't been to a COP or who hasn't been that closely involved in the UNFCCC process is a really invaluable orientation. So if you haven't already gone through that, I highly recommend that you do. Jeni also co-chairs the World Health Organization's Civil Society Working Group on Climate and Health, and she's the immediate past chair of the environmental section of the American Public Health Association. And she's fantastic. And Jeni, do you mind if I tell folks why you're not here with us in Baku?
Sure.
Jeni is gearing up for a sailing race from California to Hawaii, which I just found incredibly impressive. So we're glad that she was able to join us virtually. And over to you, Jeni.
Thank you so much, Kelly. I'm really thrilled to be able to be here, at least virtually, with all of you this afternoon. Yeah, really pleased to be talking about this issue, which is sort of the heart and soul of what the Global Climate and Health Alliance does. I will note that I was pleased to catch the tail end of the last session. We also think that storytelling is super important, and we actually got to work with Simon last year on through BBC Storyworks, collaborating on a series of short films about climate and health and solutions. I don't know if any of those might have been screened in the last session or not. So I may have taken the instruction to be the Firestarter slightly too literally. I'm going to start by sharing the fact that here in California, where I live, we're currently battling a 15,000 acre fire near the city of Los Angeles. And over the course of the last week, another 20 fires have started in the state. There are several communities in the area of the Los Angeles fire that are on notice to be ready to evacuate at a moment's notice. And apparently conditions, weather conditions this week may accelerate that fire. And our wildfire season is just getting started. That is in part by way of saying that climate change is impacting people's health in every single country in every region of the world at this point. And as we all know, it's impacting some communities and some countries far more severely than others, with far more devastating consequences. And yet, at this stage, protecting people's health, as Kelly was suggesting, is still not at the center of climate policymaking, not at the international level and not at the national and subnational level either. Fortunately, the good news, there is a little bit of good news in this, that is starting to change. And that change actually is no accident, and that's where advocacy comes in. The alliance that I lead was established in 2011 on the margins of COP in Durban that year by a handful of health organizations that had begun going to the COPs, trying to get health into the COP discussions. They had been getting nowhere. They really were making no traction on getting health into the agenda at the UN climate negotiations. And they realized that in order to make a difference, in order to get health on the agenda, they would need to bring a much larger joint health voice to the table, hence the creation of the Alliance. The Alliance then, in collaboration with WHO and with health organizations in each of the host countries, proceeded to convene climate and health summits on the margins of every single COP, every year a major summit right next to the COP, to increase attention to the issue. We've also been working inside the UN process to better understand how the negotiations work, where there are opportunities to influence them, and how to do so effectively. Meanwhile, at exactly the same time as all of this was going on, important research initiatives were launched, most significantly the Lancet Countdown, to produce climate and health research that would be useful and relevant to health and climate decision makers. At COP28 last year, we saw the fruits of many of those efforts with an important step forward with the first ever Health Day at a COP hosted by the COP28 presidency. This Health Day brought 50 ministers of health in person to COP, first time ever. It also resulted in a climate and health declaration in the context of the COP setting, in the context of the climate negotiations, that was signed onto by 149 countries. This was major, and we hope we will be able to count on a similar kind of focus on health from the COP29 presidency and every COP presidency thereafter. The momentum from COP28 on health continued last month in Geneva at the World Health Assembly with the adoption of a new resolution on climate change and health, adopted by consensus by all 194 member countries. And that resolution included a couple of quite interesting provisions, in addition to the kinds of things that one might expect about addressing the resilience of health systems and so forth. But in addition to that, it called on ministries of health to work across sectors in their countries with other ministries, because health is not just determined by healthcare, but also by what happens in so many other sectors. It also called on ministries of health to involve themselves in the UN climate deliberations, to bring the health perspective and become active participants in informing their nation's positions at COP. This is really, really important. Health has to be at the table. But I would say for all of that progress, we're still not really seeing health informing and driving the actual outcomes of these big climate negotiations like those at COP, nearly to the degree that it should. We're seeing health here and there, but it's not really at the center of how those decisions are getting made. In addition to that, and this is very concerning, there are two critical issues that are still way off track. We're sort of seeing one step forward, two steps back, and that sort of tango. And that's, the first one is we've got to tackle the root cause of climate change, which is the use of fossil fuels. The health impacts we're seeing today, from heat waves, from flooding, from spreading diseases, those are happening at about 1.3 to 1.5 degrees of warming. Our current policies are taking us toward nearly 3 degrees of warming, and the impacts we'll see on people's health at that level will be devastating. We can only prevent that dire future by getting off of fossil fuels. The other issue that remains really contentious, and this is a real problem, is the issue of finance. We have low-income developing countries that are buckling under the impacts of climate change on their people and on their health systems, and yet our wealthy countries are not stepping up with the needed finance. Meanwhile, astonishingly, direct and indirect public subsidies for fossil fuels are in the trillions of US dollars. So all of that to say is to say that we're making progress, but our work is not yet done, not by a long shot. And the good news is that we know we can make a difference. We've seen advocacy over the past 10, 15, 20 years move the needle on getting health into the climate agenda. We need to push now to get health from those kind of symbolic moments like a health day into the very heart of the negotiations and into policy decisions at every single level. Dr. Maria Neira of the WHO has said that what delegates at COP are negotiating over are people's lives. And I think that should be the thought that guides every climate policy decision that's made. To accomplish that, to make that be true, we have to work together and insist on it. So with that in mind, I'd like to close by posing just a couple of questions for this session to consider, for all of us to consider. One, what are our priorities to advance the climate and health agenda? And how do we collaborate and work together to accomplish those? Secondly, how can we ensure that health is understood not only as the healthcare sector, as vitally as important as that healthcare sector is, but also as a cross-cutting concern that informs policy decisions on energy, on agriculture, on finance, on transport, on urban development, and much more. And then finally, what do we need to bring to the table to demonstrate that the human health and health economic costs of inaction on climate change are far, far higher than the costs of action, and to drive home the critical urgency of accelerating that action now. So with that, I'll leave you and thank you for giving me a moment to speak to you, and I look forward to hearing the rest of the panel. Thank you.
Thank you, Jeni. Those are great questions, too, for our panelists. And I particularly liked your point, we'll make it into a question, but that health isn't just a sector. Health is an outcome of many sectors and many activities, and I think that's sort of the goal, to put health in the frame of an outcome and a set of metrics that we should evaluate every adaptation intervention by. So I'd like to introduce my panelists now. One of them is here in person, Dr. Michael Charles, if you'd come on up and join me. Most of you might know Michael Charles. He's the CEO of RBM Partnership to End Malaria. Welcome, Michael. And then virtually, we do have both Cindy and Cecilia. Excellent. So Cecilia Kinuthia-Njenga is the Director of Intergovernmental Support at the UNFCCC, which is a really interesting role that I hope she'll tell us a little bit about. Essentially the liaison between the UNFCCC and the COP presidency on all things sort of agenda related. And we've had a number of really interesting conversations. And Cindy Kobei is an Indigenous Women's Climate Policy Fellow at Conservation International. So we were meant to have George Wamukoya with us, and I just want to say that George is a policy expert in support of the African group of negotiators. So he provides health sector and health systems expertise to the African common negotiators, to UNFCCC and other multilateral fora. He had some really interesting points in a couple conversations I've had with him now. I hope I have the chance to interject some of those. But first, I want to start with you, Cindy, if that's all right. Just on the subject of Indigenous communities, Indigenous voices, we've heard a lot, even here over the last couple of days. We've talked about the importance of Indigenous voices, cultures, societies, expertise on mental health subjects, on food and agriculture, the panel, it came up, and I think in a couple other places too. But help us understand how Indigenous communities and, frankly, underserved communities of other sorts can contribute to our common voice and be powerful forces for advocating for health interests to show up on the climate agenda. Over to you.
Thank you so much, the organizers, for having me in this beautiful panel. This discussion is very timely, and it has come at such an opportune time. So just to give a bit of background, as I have been introduced, my name is Kobei. I'm from the Ogek community, which is a hunter-gatherer forest dwelling community in Kenya, and that is my ancestral home. So we are a community that has suffered various forms of land injustices, which has in turn affected the health of our communities, the health of our mothers, of our children, and which are all vulnerable groups. And most, I'd just like to say to give you a bit of a story of how I normally talk about climate change when I'm talking to my community, so they can understand and make it, so it also links climate and health. And it will also answer the question of Jeni when she was asking about what is the link between, how can we make communities understand the linkage between climate and health. I normally tell them that assume that the planet is sick, and once the planet is sick, it obviously affects the health of the ecosystem, the health of our plants, the health of our traditional medicine, and the health of our traditional food. And once everything is sick, we are all sick, and we cannot be able to survive in a sick planet. And that's why we need to take part in this discussion. And just to bring it back to the question where I was asked on how we can how Indigenous voices and how marginalized communities can be able to take part in this discussion, is that first we need to stop thinking about Indigenous people as voices, but as actors and important stakeholders in this discussion. They are no longer just victims, but we are partners. We are solution bringers. We are the ones who should be in those roundtables that discuss solutions to addressing the problems, and we are stakeholders, and that's what we need to first change the mindset, and then we can move forward. Once we have these Indigenous peoples in this discussion rooms, we'll be able to have more. They'll be able to drive more resources to the solution drivers, which are Indigenous peoples and local communities. And from the past year, I have seen that a lot of finances have been going directly to Indigenous communities. Most of the proposals that I've been seeing, they highly encourage highly encourage funding for Indigenous peoples and people's organizations, the community-led restoration. We are seeing a change of funding structures, and this is really commendable, and we would love to see more of this in the coming years. And this will lead to increasing the capacities of Indigenous peoples organization and local communities, and also the women's rights organization and other underserved organizations. And once we also have them at the decision-making table, they'll be at the heart of engagement, and they will also push for things like equitable benefit sharing models, solutions that actually benefit communities, and they're not kept at the middle of all these discussions. And when it comes to the UNFCCC, the voices of indigenous peoples will be amplified if I hope Cecilia will also speak to this on the creation of a formal platform for engagement of indigenous peoples and local communities. We already have the local communities and indigenous peoples platform, but at the moment it's still informal. So what we need is more formal spaces for indigenous peoples to engage. And just to go back to my comment on finance, the finance needs to be thoughtful. It's not just any kind of finance, but finance from investors that think about the planet, that protects, that have projects that are ongoing that favor the planet and not destroy the planet, that cause pollution, that harm the planet and make it more sick, that harm the plants, that harm our traditional medicine that we use to treat the health of our bodies. So those are the things that we need. And with all this, we as indigenous peoples, as underserved communities, we see that it will increase the engagement of indigenous peoples in this discussion. Thank you.
Thank you, Cindy. That all makes a lot of sense, and let's put the sort of resources aside for just a second. Obviously, that's pretty core to everything we want to do. But I'm thinking back to something you started with, which is this many indigenous communities and cultures having a more innate sense of the connection between planet and our human selves, right? And that being really core. And I'm just thinking about the fact that that isn't the case more broadly. You know, until recently, most people weren't making that connection, or if they were, it was a very academic, sort of intellectual way. And thinking about the emphasis that Jeni Miller put on storytelling, that strikes me as a huge sort of, unlocked resource. If we can help amplify the stories, but not just amplify the stories of indigenous peoples, but amplify that sensitivity, that innate sense of connectivity. And then also thinking about what Jeni said in terms of like, how can we work better together toward those aims? Any thoughts about how the broader global community, not just the global health actors, but everyone who's engaged at the climate and health intersection can help amplify those stories?
Please pardon your question.
Just wondering how we all can be most helpful in amplifying stories of indigenous peoples and their that core connectivity between planet and health.
I've actually seen one of the ways that you are amplifying the voices. The video that was being played before this panel session was talking about showcasing the stories and actually documenting the stories through the video that you projected. I saw in the video that they were talking about traditional knowledge, which is actually the real life story of most of the indigenous communities, and we need to have them speak for themselves and not having other people represent them, like actual victims who have been part of this, who have been part of restoring our traditional knowledge, who have been part of documenting the indigenous knowledge of indigenous communities, and who have been part of creating like museums. Like for the Bio community, we have an agricultural center, and we need an agricultural center that not only links culture and health, and also it links culture and health because we have in In the center, we also have a herbarium which has our traditional knowledge, and and once we cultivate this cultivates the intergenerational knowledge transfer. And once we have all these structures in place, we'll be able to push for more push for more space in the media sector, for more storytelling to go to communities that are actually doing the things. And we have tangible evidence. By tangible evidence, we have the centers, we have the videos, we have the books, that actual documentation that we can see, touch, and feel.
Great, thank you. I like that. That's great. So switching gears a little bit, Michael, although still in the space of advocacy, we have not talked actually so far in the last couple of days much about climate-sensitive infectious disease. Of course, it comes up as one of many of the more sort of visible examples of the way that global warming is affecting our health and the global health burden. But talk to us, and tomorrow actually we do have a panel that I hope you'll be around for, talking specifically about dengue, but then followed by a more general conversation on climate-sensitive infectious disease. But you lead an organization that's all about advocacy, really. And in fact, you are sort of the mouthpiece for 500 or more sort of smaller malaria-focused organizations, all of whom need that advocacy. Talk to us both about, share with summit participants some of what we do know about climate's impact on malaria and what that means for our collective vision to eliminate the disease. And then I'd also love to hear your thoughts more from the advocacy point. What do we need to be doing more of? What are the specific policy levers that are most important to the malaria cause?
Great, thank you very much, and great to be here. And very good question in terms of advocacy, malaria. But let me just put a spotlight in terms of the human face to climate and some of the consequences that we're seeing in the communities. I'll go back a couple of years in terms of the cyclone Idai in Mozambique. That was in 2019, and I was fortunate to be there 2 days after the cyclone hit. The cyclone was a cyclone that displaced over 3 million people in southern Africa, and I was in this particular province called Beira, where thousands and thousands of people were displaced. They were displaced and moved into a school of 15 classrooms, housed over 10,000 people. You can imagine what that came with. It came with water sanitation issues. It came with protection issues because the women were violated in the evenings or at night. And it came with many, many health consequences, including malaria. Now, let me focus on malaria being obviously a partnership organization that works in malaria. Because of the climate crisis, we've reached what we call the perfect storm. We have what we call insecticide resistance because the earth is warming more, the mosquito is mutating, and we're seeing that it's not effective to the nets we have, to the medication we have, and to the rapid diagnostic tests that we have. So that's a real big issue that we're facing and we continue to face. Funding is another thing, conflict is another one that we're looking at. But in all this, what we see in the communities, as we all know, is, the protracted crisis. We see cyclones, hitting communities over and over again, communities not being able to recover, and then another cyclone hits them, as an example. What does this all mean to the average man, woman, family in the communities? Obviously, with the more cyclones, with the flooding, there will be, a lot of rain, a lot of stagnant water, breeding ground for the mosquitoes, and unfortunately, illnesses goes up, and unfortunately, we see the deaths as well. So morbidity and mortality continue to rise. This has an effect, obviously, on the school-going children because there will be absenteeism from school. It also has an effect on their cognitive state. So depending on the severity of the malaria, it can affect their development on the longer run. Loss of productivity is obviously something else, that we do see in the communities, and annually we say, on the African continent, they lose about $12 billion due to malaria. Currently, there has been new research that has come out to say if we're able to reduce the burden of malaria by 90%, we will be able to have a boost in the African economy by 127%. So all this crisis is really putting a strain on the health system. A health system that is already fragile, a health system that is not able to cope, and then again, due to the climate crisis, we're really seeing all this exacerbated as we go along. Before I came to this conference, I engaged with a few communities, as I usually do when I go to the field. And I told them that, I was coming to speak at this conference and, give me your thoughts. And I have basically 3 quotes from them in terms of, their thinking. One of them said, "We are tired of being quoted as statistics. We need action." We go to conferences over and over again and we just quote, data, we quote statistics, but these are actually humans that are affected. So how do we now start moving from, talk to action? And I think that's where advocacy comes in, and that's where an organization like ours come in as well. Another quote was, "We have contributed the least to the climate crisis, yet we suffer the most. We want the world to hear our story. We want the world to support us. We want the world to really come to our aid." The last quote was, "What is it that you save the planet, but there's nobody else to live on the planet?" At the rate we're going, people are dying because of the climate crisis. And one quotation was, what will it take for us to take action? What will it take for us not only to save our planet, but to also save the next generation, and including our generation as well? So I think when it comes to advocacy, platforms like this is really used to tell the story, to bring the human and compelling stories of what we're seeing in the communities, but more importantly, for us to be able to amplify the voices of the most vulnerable, the voices of our marginalized community, as we heard, but also the voices of all our collective for our planet. There's a saying that I'll end with that says, "We didn't inherit the land from our forefathers, but we borrowed the land from our next generation, from our children and our children's children." How do we make sure that we leave a planet that is worth living for the next generation? Thank you.
Thank you so much. Yeah, I love that concept. And I think most of us in this room and online following the summit share that kind of sense of moral obligation. Probably we did before the climate change equation, and now that's sort of the injustice of those least responsible for climate change bearing the brunt of the problem is just, worsening that. I want to go back to what you said about the statistics, and that's always tricky. I mean, we've just heard a panel on the power of storytelling, and so that's one response to that, right, is to tell the stories that every one of those 600,000 deaths last year was a human being, and that makes for maybe a more powerful issue advocacy case. And really, to the person that lost their child to malaria in a village in Tanzania, the number globally doesn't matter to them, right? So, and it's just overwhelming when you start thinking about that. But I wonder, what, just in the spirit of Jeni's challenging us to think about, specific asks. You have those perspectives from the community members, which are so powerful. how does that translate into policy, that we can all get behind, that we can all align behind? Is it as simple as more resources? Is it as simple as more money being spent to eliminate malaria faster? And we'll talk tomorrow about more of the technical aspects, the tools that we do and don't have available. But are there other policies related to climate change that we should keep in mind when we think about its impact on malaria transmission?
Yeah. I think, you hit on one point. Money is important, but it's not the only factor in, the discussion we're having and the equation between, malaria and the climate crisis. There are a few other things that I think we can do from ourselves and from everybody in this room. The first one is around partnerships. How do we look into partnerships in a manner that is beneficial to the man, to the woman, to the boy, to the girl in that community? How do we make sure that we have innovative partnerships, as an example? The next one is, how do we bring the power and the innovation of the youth into the equation? In terms of the malaria world, we are actually working quite closely with the youth. We have what we call the youth army, who are really helping us shape some of the conversations, shape some of the advocacy, shape some of the innovative thinking, which sometimes people of our age will lack. So really bringing them in to help us shape the discussion. I think the third thing is, and I think it was mentioned earlier on, is the cross-sectional approach. We cannot look at malaria from a health lens alone. We need to look at it more broader within the health system, but also, linking it to agriculture, to infrastructure, to education, to the private sector. So really just thinking outside our bubble and trying to see how we can, bring others on board, I think is some of the things we need to do. And then again, really working with the legislators, with the parliamentarians, and really make sure that they understand in terms of their action in this, in terms of reducing the burden of malaria generally within our continent and the globe.
Thank you. Yeah, that is powerful, and we'll come back to that, I think, in our sort of lightning round when we finish. But now I want to finally speak to Cecilia. Hi, Cecilia. Maybe you can start, first of all, after my question, by explaining your role at the UNFCCC a little better than I probably did. But wanted to talk to you really about, as we kind of focused on moving beyond just issue advocacy, promotion, and storytelling, and all those things that are very, very important, and start to get to a point where we're asking more specific policy demands of our leaders. And I imagine in your role, you've seen lots of advocates and issue champions, and they've probably even come to you for advice about how do I get my issue on the table at COP? How do I bring more global attention to this issue that's so important? What have you seen that has succeeded? What's an example before our collective efforts to get health more central to the COP negotiations that you can point to and maybe give us some advice about how to move forward as a community?
Thank you very much, Kelly. Really glad to be joining this session. Actually, I couldn't be there in person in Baku, but I'm really glad to be joining you. Yes, my role at the UNFCCC is that of providing the intergovernmental support to both the subsidiary bodies and the governing bodies of the Convention and the Paris Agreement. And therefore, I am involved, working very closely to the chairs of the SBs, as we call them, the subsidiary bodies, and the governing bodies, involved in supporting them in their processes of agenda setting, but also in conducting the various meetings, conducting the negotiations and reaching decisions and outcomes of the different SB sessions and the COP. So in this particular case, as we move towards COP29, my role involves working very closely with the presidency We normally call him the CPD. This is the COP president designate based there in Baku, and also in parallel working together with His Excellency Yalchin, who I believe spoke this morning, who was responsible for leading the negotiations of the expected outcomes for COP29. So in essence, it's more of the formal part of the negotiations, which is increasingly at our COPs becoming even smaller and smaller as the climate action space becomes bigger and bigger. And therefore trying to continue providing legitimacy to the COP process to ensure that the outcomes of the COP really are what the parties themselves deem to be. So the agenda setting process within the UNFCCC is governed by the draft rules of procedures applying, and therefore agenda setting is very strictly managed within what is required within those rules of procedures. The presidency, however, on the other hand, has an opportunity to drive his or her own initiatives that would allow them and support them in landing a COP outcome that responds to their vision. And I think it's indeed important that you are sitting there in Baku today and having an opportunity to interact with the presidency in order for you to advocate and influence so that, and you don't really have to do much about that because I've already seen the thematic days proposal by the presidency, of which health again will be one of the thematic days, and therefore I believe you are already a step further. Earlier on, Jeni already spoke quite well and expounded about the advocacy efforts that the health community has been making to place health at the center or at the heart of the climate change negotiations. And you've really just asked me, Kelly, to expound a little bit more on where some good examples exist. And I'd like to look at them in three buckets, if I may. One is those that are happening within the climate action space. They are not formally within the agenda, but they are seen as drivers and to a great extent influencers in terms of ensuring that the negotiations are kept aware or alert that these are critical issues that need to be considered when they are negotiating. And it's already been mentioned earlier by Michael and also by Kelly that health is a cross-cutting issue, and therefore it crosses across all areas of adaptation or mitigation, and therefore should not be really difficult. And I'll be giving you some bit of statistics here to show that we have actually seen a growth in terms of the impact that the advocacy is having on the process. I mean, the convention does mention in its preamble the importance of the impacts of climate change on health and the need for countries and parties to take cognizance of that. The Paris Agreement went on further to not only talk about the impacts to health, but also the right to health, and really basically elevated it to a higher level. And we have now seen with the global stocktake and at COP28, this one CMA5 having 10 mentions of health. And that's really a process that's indicating that just like other issues that I'll share with you very briefly now, that have gotten themselves into a higher level of consideration in the intergovernmental process, health is really rising up to the occasion. I'd like to highlight one of the areas that I also support work in, which is the oceans work. The oceans now, since COP26, and through a lot of activities, whether under the Marrakesh Partnership or in the climate action space, have managed to get itself through the subsidiary body of science into the agenda. And since COP26, the 26th session of the Conference of Parties, SABSTAR are now holding an annual dialogue, starting with the 56th session of SABSTAR, and we even had one dialogue during the current SB SABSTAR 60. And that's really an indication that the issue is being taken seriously, and parties to the convention and to the Paris Agreement are committed to see how the issue of oceans and climate could really be undertaken. It's still not formally in the agenda as a negotiating item. It's still at the dialogue level. The same applies to the children and youth, which is a new mandate that came from COP28. There is now an instituted a platform through a children's dialogue that will be held every year, and therefore elevating that issue also for consideration and higher level consideration in the legislative process of the convention. We also have the mountains issue, which is also a new issue where we had the first dialogue again undertaken through the adaptation track of work, again a dialogue under that through this COP. So I would like to say that there are opportunities, there are those that have really matured, gender, the action for the ACE as we call it. These are also aspects that grew and now are a specific standing agenda items, and it was through a consulted process, was through an advocacy for ensuring that these issues are now part and parcel of the agenda of the COP. That, you know, and we could learn a few lessons of how those were brought into the light. But as I said, you know, what I've seen and observed, I was in the Africa Climate Week. I spoke at the meeting several times on health and the linkages to climate, and I do see that there are some good headways that you're already making to get, you know, the recognition of health. Perhaps I'd like to mention a few areas where I see opportunities for leveraging. Again, we have the global goal on adaptation, and there would be an elaboration on the key indicators around the global goal on adaptation. And I think an opportunity for the health communities to ensure that during these negotiations, that you are able to advocate and lobby for the incorporation of health indicators, and not just on the negotiation space, but proactively in the national climate strategies, ensuring that you include climate considerations in the national health plans. Again, we are looking at areas of mitigation and negotiations around the mitigation work program. Again, where are those opportunities, the linkages we spoke about? We are seeing increased greenhouse gas emissions. What does that mean in health? And where are those interlinkages as cross-cutting in terms of the whole health core benefits, whether it's in transport and transitioning to more electric vehicles, or whether it's in manufacturing using technologies that are climate friendly, etc. And then there is also the area of partnerships, and Michael talked about the whole issue of partnerships and collaboration among stakeholders. And I think it's possible to leverage a lot within the resource efficiency, or looking at tailoring interventions across all areas that respond to the health needs of the community. So I see various aspects, but here I just wanted to mention in the agenda setting process, just to wrap up a little bit in my intervention, is that the UNFCCC process is a party-driven process, and therefore it is the parties that determine. And therefore what I'm suggesting here is that ensuring that you have health actors, health stakeholders within your national delegations, you know, advocating and lobbying to ensure that within that delegation at national level, you have health representatives that are interacting with the negotiators, with the policymakers, with the ministers, to ensure that this happens. One area that, one event that I attended in Nairobi during the Africa Climate Week was one to look at the interlinkages between health and climate ministers. And again, it was very evident that there's still very little dialogue or communication that's going on between health and climate. And it's no different, even agriculture and climate ministers, or water and climate ministers. So there's need of that level of strengthening to ensure that the intergovernmental processes are able to galvanize and capitalize and leverage from each other in order for us to strengthen the decisions that emerge out of the processes that the governments are driving.
Thank you so much, Cecilia. So many good points there to unpack. One of the things you said just reminded me, we're kind of talking in a continuum here from storytelling. So we just had a panel on storytelling, and Cindy, you brought that concept to us now too, that real life stories, and so did you, Michael, of humans can begin to put issues on people's radar. But then we talked too about, you know, the process of consensus and building a movement to get to the point where we're even sort of at the table in dialogue. But I think the key thing that Jeni mentioned earlier too is how do we move, from, and you just touched on too, Cecilia, how do we move from dialogue to actual negotiations, or as Jeni put it, from sort of symbolism to substance. And I think that's kind of the moment where we all sit right now. We're conscious of this huge momentum around the climate and health intersection, and we're kind of trying to feel our way toward what's the substance, what are the specific policy asks. And maybe the answer is in a couple things that you both mentioned. Michael, you first brought that, the multi-sectoralism to bear. So, and it goes in both directions, right? There are other sectors that are social and economic determinants of people's vulnerability to malaria and other illnesses, but then malaria certainly has an impact on other sectors as well, and reduces economic productivity, as you pointed out. So I think there's something there in that multi-sectoralism, and something that would be helpful for us in integrating better in the broader landscape of climate actors. And to do that, and I'm just like trying to channel George a little bit here, because he talked a lot about, and you just brought up too, Cecilia, the Global Goal on Adaptation. And I should mention that the Global Climate and Health Alliance did a really nice job of collecting and consolidating feedback from their partners and stakeholders in the community to weigh in on the Global Goal on Adaptation. And one of the priorities is that health be one of the most important indicators that's included there. But that indicators point, George said some really interesting things about how we can start that at more national levels. And maybe, Cecilia, you could just talk about that for a minute. Are there ways that we can take baby steps toward having health metrics and indicators that then become core to IPCC and to UNFCCC negotiations? Is that something we should be considering doing in state level legislation, or in regional bodies, making some sort of health quantified metrics be legally binding? Does that resonate?
Yes, Kelly, yes, it does. And I think there is a low-hanging fruit here. Countries are going to be, and some have already started elaborating on their NDCs, their nationally determined contributions. And they are at the moment working on the methodology of how to prepare this NDC 3.0, which is really economy-wide NDCs. And I think if there is already ongoing work within the health community on the development of indicators, there is an opportunity to try and start testing. You can select a couple of countries, for instance, at the region, through the regional bodies, or through other sets, other associations, or through the UN that supports the formulation of NDCs through the resident coordinator system. So there are opportunities to be at the table at the design stage of the NDCs in many developing countries. Many developing countries are requesting for support through the climate promise of the UNDP, and there is an opportunity there that I see that's glaring. Of course, the formulation of national, okay, then a step back, mainly because I worked at the country level supporting the formulation of national development plans and strategic frameworks of the UN. Data remains a big issue. So it is one thing to say we want to develop indicators, but the data has to be there. Disaggregated data that can allow you to influence and have evidence that policymakers can take on board and ensure that if they are formulating an NDC and they've identified transitioning to low carbon transport, for instance, what would an indicator that would be health responsive look like? And how can you validate that data, and how can that data be communicated to policymakers to ensure that in their strategy formulation, in their legislation, they're able to incorporate that? So there is quite a lot of work, and what we are seeing increasingly as a UN family, as we are coming together to try and support the formulation of NDCs, there are huge capacity gaps, but there are also huge data gaps. So I think that could indeed be an opportunity. And Cindy was speaking earlier on the whole issue of Indigenous people and Indigenous knowledge, and ensuring that Indigenous knowledge, including Indigenous knowledge on how to maintain and manage human health, etc., needs to also be central and integrated in those processes. So for me, that would be one way. And as you asked, who do you work with? Yes, there is, as I mentioned, the UN family is supporting collectively countries to formulate their NDCs, but also there are also other regional-based organizations that would be playing a significant role, not just in the NDCs, but also in the NAPs, also in national development plans, but also in climate action responsive roadmaps and pathways. We are expecting from COP29 that there will be a specific roadmap. Hopefully, I don't want to mention that word is not very common and popular in our process, but that there will be a specific pathway or intention to show that even in the formulation of the new NCQG, the financing outcome that is expected, this collective goal on finance, that it will be very clear where this money will be coming from and where the money will be going to. So again, it's health in one way, responding to that, but in order for those health responses to have influence and impact, the means of implementation, including finance and technological innovation, will be necessary. So again, it's to identify through that framework of the means of implementation, what else can the health community do in terms of influencing the various outcomes of COP29 to ensure that there is a direct and huge impact following the inroads that the health sector has had in our negotiation process.
Thank you so much. I think there's so much of that we could unpack and that we could all learn from, and I hope you'll agree to make yourself available to those of us who are working hard to advance the climate and health issue to the level that we can be talking about things like data and indices and metrics and the best way to put them in. And it's interesting, isn't it, Michael, that like on one hand, the statistics don't tell the story, and on the other, that's what the United Nations wants to see for policymakers sort of need it. And that's been a recurring theme over the last couple days, the challenge of data and the question of, what's the right amount of research into a problem versus acting on it. So I think that's something we could come back to too. I think we included in the session description, and it looks, oh good, Cindy's back, excellent. We included in the session description that we didn't want to just talk about the people who are plugged into the UNFCCC, will be in Baku, or have access and are directly influencing the agenda and negotiations. But those of us who are just passionate advocates on the climate and health issue around the world, and what we can do, what those folks can do closer to home. So I want to ask each of you to respond to that after we take just one question that's been submitted through the app. So you can reflect on that. What can someone far from Bonn and Baku do to advance this issue? But first, let's look at a question that's been submitted. So this question says, thinking about the mistrust around commitments made at COP, what actions can be taken immediately to push for accountability to those commitments with a climate health lens? So I think this question is saying, say we are successful and we get real negotiation gains. What does that mean if there is not the accountability in place? Michael, you want to take that?
Yeah, it's a very good and interesting question. And when we talk about accountability, who's responsible for that? So my take on this would be, how do we educate, work with the populace to be able to hold their various governments accountable? So how do we translate some of the outcomes from the COP into meaningful actions that the general population can take to make sure that their parliamentarians, their governments are held accountable. The second thing is that we should not always look at climate health from a government perspective alone. What roles are we playing, and how do we hold ourselves accountable in this discussion as well? So what contributions are we making in terms of reducing the fossil fuels and the carbon emissions as a whole? So I think it's a two-way thing. How do we hold our governments accountable, but how do we also hold ourselves accountable in this?
That's a really good point, and it's kind of parallel to the question I wanted to ask about what can we do if it's not in the halls. It's like, yeah, we can reinforce the notion of our own personal accountability in the interest of building that. We have one more question submitted. For people who cannot attend or access COPs or SB 60 or other sessions, what are the measures to include underrepresented voices? What are other processes beyond the UNFCCC that are pushing for climate action that the climate and health community can tap into? Okay, so perfect parallel to the question I wanted to ask all of you about anyway, but I think Cindy, we'll start with you there. So yeah, outside of the halls of the multinational organizations and the UNFCCC and SB Bond, and what are some of the ways that folks can embrace the underrepresented and make their case and advance the issue of climate and health?
Yeah, thank you. That's a very good question. In the climate advocacy space, they always say that there's power in numbers, and once you come out as Indigenous peoples, as women's rights organization, as all the underrepresented groups, as a movement, forming alliances that can actually speak against these issues, speak against the government not following up on commitments. So that's the hidden secret, which is movement, going in big numbers, building alliances. I'll give an example of what we did here in Kenya. Kenya has a national climate change action plan, and for the third climate change action plan, there wasn't any focus on Indigenous peoples. It was just mixed in within other issues like gender, forest, all those things. But there was no standalone area on just Indigenous peoples and local communities. So we formed an alliance. We came out in numbers. We spoke. We even had a pre-conference to the Africa Climate Summit, and where we had numerous African Indigenous peoples come together and they had their own declaration. And those are some of the steps that we have taken as Indigenous peoples in Africa, and also as Indigenous peoples in Kenya. And that's where we're coming out really strongly. And as Cecilia said, the UNFCCC process is party-driven. So most of the work starts from the country level. So how are you as an organization or as an individual? But it's always good to work in numbers. Talking to the government. Are you having dialogues with them? Are you co-creating these solutions with the government? How are you working with them? How are you trying to push the climate and health agenda into the national agenda? What are some of the steps that you have taken? So those are some of the things that people who are not going to COP. And just to put it out there, the UNFCCC process is not the end. You can do so much more at the national level. And once you do the thing that you're doing at the national level, it will go all the way up to the international level. There are people who will be there to represent you. Whoever is not going to COP, just know that you're well represented by other people like Cecilia and the rest. Thanks.
Thank you, Cindy. You wrapped that up so nicely. I think we can end there because we've touched on all of those things now. So there's strength in numbers when it comes to advocacy. To do that, we have to tell stories more effectively to get people behind a movement. We need to reach across sectors and recognize that health isn't just about the health sector and health service delivery. It's dependent on so many other things and determines so many other things. And so we can come together around, and then maybe, you know, the key for us as a broad community caring about this issue is to pick a few battles that we can all get behind rather than fragment ourselves around individual smaller issues in the same category. And so I love that all of that came out. I think that's super helpful. Thank you so much, Cindy, Cecilia, Michael. Thanks for being with us today. Let's give them a round of applause.